Okay, so I'm going to demonstrate how to do a dressing change, wound culture, and irrigation. So I'm going to knock on the patient's door, clean my hands, introduce myself. My name is Liana. I'm going to be taking care of you today. Can I have your name and date of birth? I'm going to check their ID band and make sure to see if they have any allergies. I'm going to check the doctor's order against their band and just tell the patient that I'm going to remove your old dressing, irrigate the wound, and we're going to get a culture and replace it with a new dressing. Okay, so I have my supplies here at the bedside. I'm going to put on my clean gloves and remove the old dressing. Careful not to pull the skin. I'm going to assess the bandage here for any purulent drainage or anything abnormal. We're going to throw that in a biohazard bag. And I'm going to assess the actual wound here, especially the edges, and I'm going to measure it. So I don't have a specific measuring device, so we're going to use, pretend this is my sterile cotton swab, and I'm going to measure the length. Come over here, and it's about 6.5 by 2. By 2. Okay, so I'm going to take this and throw it away, remove my gloves. I'm going to wash my hands again, and at this point I'm going to set up for my irrigation supplies. So I'm going to grab my sterile saline, and I'm going to make sure it's not expired. This is a brand new bottle. I'm going to grab my cylinder here, and I'm going to grab the gauze so that I can soak that with the saline for when I'm ready to pack it, and I'm going to grab my culture. Okay. At this point, I'm going to grab my visor to protect myself and the patient. Okay. And my hands are clean. I'm going to open to pour here as well. Okay. I'm going to put on my clean gloves, and there's going to be a chuck underneath in case anything spills over on the side. I'm going to take this here, and we're going to begin to irrigate in a Z-like formation, making sure that the wound is clean. Okay. Move this out of the way, move this out of the way. And at this point, I'm going to grab my culture. And we're going to make sure to grab enough surface area. Okay. And we're gonna label date, time, and make sure this is the correct patient information for when we send this off to the lab. Here, take off my gloves. Clean my hands again. At this point, I'm going to gather my sterile field. My dressings and everything. I'm going to open up my ABD pad. The gauze. And we're going to open that. I'm going to open the suture removal tray. Okay, so my hands are sterile. Okay, so I'm going to begin to pack the wound. So we're carefully going to place this in the wound, make sure not to touch the edges. Not to touch the edges and not to make sure that it's too tight. And lastly, I'm going to grab my ABD. And at this point, I would take my tape, make sure to get all of the edges, and I'm going to label it, time and date it. Take my gloves off, clean my hands. I'm going to ask the patient if they're in any discomfort, if I can get them anything. Make sure the bed is in the lowest position, and I'll be rounding on them within the next hour or so. I would come back and make sure to document any of my findings. Sanitize my hands, and that's it.